A scar that tells a story. Meet the patient who traveled a years-long journey to learn the source of his seizures. It would turn out the issue lived in his left temporal lobe. That's today on All Things Brain Health. Good morning and welcome to All Things Brain Health. I'm Alexis Delstead. Brad Wagner lived with an unexplainable seizures for most of his life. Finally, as an adult, doctors diagnosed him with epilepsy. This morning, Brad joins us virtually from his home in Colby, Kansas. Brad, thank you for joining us with your beautiful wife, Kay. We really appreciate you taking the time to share your journey this morning. And also joining me here in the studio are two members of Brad's medical team at the University of Kansas Health System. We have epilepsy neurologist Dr. Maggie Logan, and we're also joined by registered nurse Allie Goff. Allie is also the epilepsy surgical program coordinator. Thank you both for being here. Okay, Brad, I want to start with you. Right out of the gate, how are you feeling today?
Good so far.
Good so far.
Haven't had any problems.
How have you been feeling lately?
Good. I haven't had any problems for quite a while. Once in a while, depending on stress and what used to cause them all the time and stuff, I would almost feel like I'm going to have one, but nothing ever happens. That's only happened a few times since I had the surgery.
And that's a super interesting component to this. We're going to get to all those feelings in a minute that you get when you think you're going to have a seizure, but now they don't happen. But first, I want to go back to those images that you shared with us of that scar on your head. Those are really something. When looking at those surgery scars, when was it?
In July of last year.
Okay. So July of last year. And Kay, you and your husband live about 5.5 hours away driving. You're in Colby. So how long was your husband in the hospital?
For the surgery, he was there for about 3 days.
3 days. And then what did you do during that time?
It was a very stressful time for me.
I can imagine. I can imagine this whole journey has been stressful. One thing that's fascinating is, Brad, your description of your seizures later in life is not what many people would expect. You did have the traditional seizures when you were a child, but then you described the seizures you had more recently as being subtle, like you would walk away in the middle of a conversation. How often would that happen?
The last few years, quite a bit. I mean, I wouldn't say all the time, but a lot of it was stress related and what was going on, but just I could almost feel like it was going to happen, and if I tried to keep doing what I was doing, something would happen, but if I just stopped what I was doing and go off on my own, nothing ever happened.
Kay, Kay, as a wife, I can't imagine what it's like to have your husband constantly, well, we all can imagine, walking away in the middle of a conversation. Did you know he was walking away because a seizure was coming? What was it like from your perspective?
We've dated a long time, and before that, he used to have full grand mal seizures. Why they went to the way they did, I don't know, but sometimes it takes you a little bit to figure out that he actually was having one. But once you realize that and just gave him space, it was okay. It was just something that I've been with him so long, and we've been through so much that I just knew what to expect.
How long have you been married?
17 years.
17 years. Congratulations. That's a long time. And do you remember the first time he had a grand mal seizure in front of you? When was that?
Oh, that was clear back when we were dating. We dated 8 years before we got married. Gosh, that was...
I don't know. Long time ago.
Probably like in 2000 is probably when I seen his a full epilepsy. I have a little bit of a medical background, so I knew what to do. So for me, I mean, it's always scary for anybody to see that, but I was able to stay calm and just guide him and direct him wherever. Like if he was standing, sometimes he would stand and then fall.
Oh my.
So I would just try to make sure everything was out of his way.
Dr. Logan, when it comes to the kinds of seizures Brad was having, he said before the surgery he was having them in a different way where he would feel them coming on and walk away. How common is that?
The specific situation with him walking away is maybe not as common, but the type of epilepsy that Brad has is one of the most common types of epilepsy in the adult population. He also has like confusion with his seizures and some fidgeting, and that's one of the most common types of seizures that are coming from the temporal lobe as well.
I just want to be clear on something. Brad, was the walking away something you did intentionally to avoid the seizure happening, or was that the seizure that you didn't realize you were even doing?
I could feel them coming on soon enough that if I did that, I'd just walk away and
Okay.
I quit focusing on what I was doing, I guess.
It was like a coping mechanism.
Right, yeah.
Okay. Allie, what's happening differently in the brain between the grand mal seizures and then the kinds of seizures where Brad can feel them and he knows they're coming, so he stops what he's doing and walks away?
Yeah, so I think Dr. Logan can attest to this a bit more, but there are different types of seizures, and some come from a very focal part of the brain, while others spread rapidly and go from other various parts of the brain all over. So,
yeah, I think that's a really good answer. That's what I would have said as well. There's different types of seizures, and so Brad has a type of epilepsy called focal epilepsy, meaning that it comes from one part of the brain. And so that's why it looks different from the seizures you see on TV with the big convulsions and loss of consciousness and things like that.
Now, he says he did have those big convulsions earlier in his life. So early in his life, did he have a different kind of epilepsy that changed?
That's a really good question. So no, it all started in that one area, but it can spread rapidly to both sides of the brain.
Oh, okay, okay. And Brad, you wound up here at the University of Kansas Health System in Kansas City. That's a long drive from where you live in Colby. How did you discover Dr. Maggie Logan and her team?
We have a regular doctor, or is he? He's not really.
We used to go see Brian, and Brian Unruh, our local physician, sent us to Mike Seeley. And then Mike Seeley changed, and Mike Seeley is the one that sent us to KU.
Got it. So you were referred here. And
Yes.
Brad, this is where you underwent a week-long workup, and doctors during this workup tried to trigger a seizure. What did that look like, that process of trying to trigger seizures for you?
Wasn't much fun.
What would they do?
Got to lay there and not do much for a week.
Uh-huh. And what kinds of things would they do to try to trigger a seizure?
They started cutting the medications to begin with, and nothing was happening, which I kind of told them nothing would happen because just by laying there doing nothing wouldn't cause any stress or anything to make one happen.
Got it. You know, I got to say, I was picturing someone coming in and doing a strobe light because they warned people of seizures at that. So I was thinking you were doing lots of sensory things.
We actually do. We do strobe lights, certain frequencies that can cause seizures, and then we also do hyperventilation, having them breathe heavily for like a couple minutes to see if that triggers anything. But otherwise, it's mostly, like you said, taking off the medications, and it's hard to simulate like a perfect home environment, you know, because they are kind of stuck in bed.
One super interesting thing about this is that, Brad, when your seizure wasn't triggering, you said, okay, I can do this myself. What did you do, and how did you wind up triggering your own seizure intentionally?
For one, dropping medications altogether, because days I forgot them were days that things would start. And then also being around chemicals at the shop, like brake cleaner and things like that, would intensify it to where I usually had one.
So you had your...
That's why.
Did you have your medical team
so
go get brake cleaner to have you smell that scent?
My wife did. Went
You
to
did?
Mark's house and got some and brought it back in.
So, okay, what did that conversation look like? He says, go down to the shop, get me brake cleaner. You're here in Kansas City already, not your hometown. You go to the store and you just have to pick up something to trigger your husband's seizure?
Pretty much, yeah. I left the hospital and went to AutoZone and got some brake cleaner.
So odd. And how quickly after you smelled that did you start seizing?
I believe it was that night or the next day, wasn't it?
I think it was the next day.
Yeah.
Because we finally got him convinced to take him off all the medicine as well. And with the brake cleaner and off the medicine, it triggered it.
And you work in an auto shop, Brad. You work around cars, so you knew this was a trigger?
Yeah.
What an awful coincidence that you work in an environment where the very scent of where you work triggers your seizures.
Yeah, well, I own the business, plus being around the stuff, and then also the stress of trying to run in the place didn't help it.
Right. Allie, why is it important to trigger a seizure during that workup?
Yeah, so it's really important to capture that information on our video EEG setup that we have that gives us information on the EEG and video at the same time. It helps provide more information on localization, so it gives us more information on what we can do for treatment options for the patient.
Dr. Logan, is it possible that a scent can be cumulative and then that winds up causing a seizure? Or what is it about the scent that causes the seizure? Is it when he feels stress, he also associates it with that scent and that's what triggers it?
I don't think so. We've seen certain things trigger seizures. I don't think we fully understand exactly why those things trigger them, but like poor sleep, stress, certain smells, hot environments, a lot of things like that, even alcohol, drugs, certain foods, caffeine for some people. You just have to figure out what your triggers are and try to avoid them like Brad was trying to do. It's just hard because he worked around a lot of those things.
And so he knew firsthand. We have some images, Brad, of your brain scans that we want to show our viewers, and I want to ask Dr. Logan, this is the before image of Brad's brain. What do you see here that led you to believe surgery could work?
So when we're thinking about surgery, a lot of things come into play, and the EEG is a big part of that and some other imaging studies, but this MRI was very useful in Brad's case because there is an abnormality there. I'll kind of walk you guys through it so you can see what I'm seeing. That's one of the MRIs of his brain. It's a horizontal cut straight through the center like this, and you can see his eyes there and the nose on the front of it, and then the rest of his brain in the picture behind it. The screen is flipped just with how Brad was in the scanner, and so the left side of the brain is on the right side of the screen and vice versa.
Okay.
And so if you look on the right side, that's the left part of his brain, and if you compare it to the other side, at the very front part of the brain and the side in that middle area, there's this bright part. It's kind of subtle, but it's a little bit brighter on his left side of his brain. And so we knew something was going on there. We weren't sure at the time if it was a congenital malformation or some kind of low-grade tumor. And so that's why the surgery was a really important part for him, and even getting like pathology to see what was happening there.
Are those black squiggly, it looks like lines, were those drawn onto the scan to point to something, or are those things in his, if you're looking at the screen on the left side?
I see what you're pointing out.
What are those?
I don't know actually. Okay. I don't know if that was just an accident when the picture is being taken, but it's not probably from the actual MRI itself.
Okay. And you performed a resection surgery on Brad. So we have an actual image of Brad before the surgery and after the surgery, his brain images. Explain to us what you do during a resection surgery and what we're seeing in the after image on the right.
And so Dr. Chris Miller did the actual surgery. He's the neurosurgeon. He's amazing. He couldn't be here today, but as far as the scans go, you can see on the left side of the screen, there's that bright white area on the left side of his brain. And then if you compare it to the right side of the screen, you can see that that white area is not there. And so basically on the right side, that's before the surgery, and then it's the same scan on the left, and that's after the surgery. So you can actually see what was removed during the surgery, and it was the front and the middle part of his temporal lobe.
Got it. And you're in the room during the surgery while the neurosurgeon is doing this. What are you monitoring?
Oh, that's a good question. And so during the surgery, I come down for pieces of it, and the other epileptologists basically, they can put a strip on the brain looking at brain waves when they're removing it. And so they do that before and after, and we'll read the brain waves during the study. And what it shows us is we can see that irritable part of the brain. Sometimes it's not perfect. But once they remove it, they can put the strip there again, and we can see if they got that irritable tissue that's more likely to be the cause of the seizures.
I know this is kind of a strange question, but how big of a chunk of brain are you removing? Like compared to the cap on a water bottle, how big is it?
Well, it depends on the side of the brain that they're removing, because on the left, a lot of times that's where the language part of the brain is.
For Brad's brain, how much do you remove?
Yeah, so for his part, since it was on that same side of the language, it's 3 to 4 centimeters.
3 to 4 centimeters. Okay. That sounds daunting when you hear you're going to have brain surgery, I would imagine. Allie, how do you guide your patients through that process leading up to that?
Yeah, a lot of people are understandably scared of having brain surgery. A lot of people are looking for connection. So a lot of times I will connect patients with past patients who've gone through the procedure before, give them some comfort on someone who's been in their shoes.
Brad, what did you do leading up to the surgery? And Kay, how did you process it?
For me, it didn't bother me as much as her.
Okay. Spoken like a true husband. So you went in kind of nonchalant, and Kay was the one who was nervous?
Yeah, it didn't. I mean, I guess it was in a roundabout way scared to go into it, but it just didn't bug me as much as it did everybody else.
Kay, how did you handle it? I'd be really scared if my husband was going to have brain surgery.
Yeah, I didn't handle it as well.
That's understandable.
I just, I was the note taker and wrote a lot of questions and asked a lot of questions, trying to lead up to it.
So you were trying to do the best you could to control the controllables, get all the information.
Yeah.
And Allie, we have the neurosurgeon in the room operating on Brad. We have Dr. Logan who's monitoring the EEG.
Yep.
What's your role on that day?
My role is to send all positive thoughts to my patients, schedule any necessary follow-up, but my home on surgery day is in the clinic.
Did you see them come in that morning?
No.
Okay. I would think you'd be such a calming person, a calming face to see, because you are very calming sitting here. You have that aura about you. We have some great questions and comments that are already coming in from our viewers. So if you have anything that you would like us to ask or read aloud on the program, you can send it to us right now on YouTube or Facebook, and you'll find all the links on how you can connect with us in real time on your screen. Brad, going back to your childhood, at what age do you remember having your first seizure?
Probably around 13, 14 years old, somewhere in there. Well, probably earlier than that. Probably closer to about 10 or 12 years old is when I remember first having issues. And through high school and then getting out of high school and stuff is when I remember the worst ones.
How did you process that as a kid? Where were you when you had your first seizure? What happened?
The first one, I'm not 100% sure where it started, but the ones that I remember the most are the ones being out in public and in school and stuff where, people noticed and made a pretty big deal about it, because at that time they were grand mal seizures.
Wow.
So,
and did you feel self-conscious afterwards, or did the people around you understand this was epilepsy?
After several people understand what it was. I had enough closer friends that just stood around and told everybody else, watch it, and I guess kind of in a roundabout way make it humorous.
You used to tell us that stress used to trigger your seizures, but also certain smells from your auto shop. Does that still happen? Because you still own an auto shop. Do you get those sensory triggers?
I've had a couple of times where it felt like something was going to happen, but it never did.
Sure.
I'm not to the point where I stopped what I was doing and went on, but you'd get a feeling like something was going to be there, and it never happened.
Okay.
It's hard to explain.
That's what I was going to ask you. Is there any way to explain it other than it's a feeling? Like, does it feel like a sneeze building?
No, I guess before when that happened, it got to the point where maybe a little more aggressive feeling of if you keep doing anything. I mean, you knew you were just going to lose control of it, or I guess knowing what's going on, you'd lose that, I guess. But now, if I feel like something's going to happen and I try to think about what I need to do to keep it from happening,
sure,
then nothing happens.
Is that because of the surgery, Dr. Logan?
I think so, yeah. Those may be like very tiny seizures that are happening, but because of the surgery, it's unable to spread to bigger areas of his brain to cause more of those issues he was having before with the losing consciousness or getting confusion and things like that.
So the seizure sparks are starting to fly, but there's nowhere for them to go.
Yeah, I think that's a good way to describe it.
And why do people get auras?
Oh, that's a good question too. I don't know that we completely understand that, but we know that some people's brains just have that propensity to have recurrent seizures, and that's what epilepsy is. And seizures are just this abnormal electrical activity in the brain, and what comes along with it is an imbalance in the neurotransmitters.
So when it comes to medication, Allie, in addition to the surgery, post-surgery, what is the protocol for Brad when it comes to his medications?
Yeah, I think a good way to put it is low and slow. So usually we visit tapering off of medications once patients are at least 1 to 2 years post-surgery. So I think you guys have started maybe tapering, have you?
We have,
yeah. So that's a conversation for our surgical patients with their epileptologists after surgery, what that might look like. For some, they might stay on the same medicine forever.
In the same dosage too?
Yes.
And how many people actually can taper entirely off their medication after a surgery? How common is that?
Oh, that's a good question. It's not very common. I would say maybe a half or less could completely come off all medications.
Okay. Oh, that's a big percentage.
Yeah,
I mean,
yeah, it's still a good amount.
50%. That's huge.
I always just tell people we may not be able to come off. It just depends on the situation.
Yeah. Right. And then Kay, having a husband that's no longer having these seizures, how has life for you changed?
It's changed a lot. He used to have a really bad temper. And since the surgery, his temper, he's a changed person. I've even had people come up to me and they're like, wow, we should have done this a long time ago. And I'm like, I know. His attitude and his personality, he's just really calmed down. And I feel like he's enjoying life better.
Does that lack of a temper come from a renewed perspective, do you think? Or is that because of the surgery, was the temper a sign of the epilepsy or a symptom of it?
Well, I stand on faith, and I know my prayers, and I know how I prayed, and I really just believe it's an answer from the Lord. I know scientifically you guys probably have different answers, but for me, the Lord gave me the husband that I was wanting.
Oh, that's so sweet. That's a really beautiful thing to say. I want to get to some of the questions. I do want to ask the doctor before we get to Ruth Ellen's question, is having a temper a symptom of, she had said the doctors might have better answer to that. Is having a temper a sign of epilepsy? Like one of the side effects?
That's a really good question. And so they are tied closely together. We see that people with any sort of like agitation or mood issues have an increased risk of having epilepsy and vice versa as well. And so we see that sometimes after surgery that, their mood changes and their personality more to what they were like maybe before epilepsy started.
Oh, that's interesting.
It has to do with all those neurotransmitters changing in the networks.
Ruth Allen has a comment. She writes, thank you for the program today. A close family member had recently been diagnosed with seizures, and we are just starting this journey. And she also wants to know, what's the recovery like after a seizure, and has the medication affected energy levels or anything else? So I'll take the first question to Brad. What was the recovery like after your seizures?
For me, getting home in the first few days, were maybe a little different, but after that, I felt normal. The only thing that really kept me from doing anything is I wasn't supposed to be doing anything.
Right.
So, but as far as every day, I mean, I was going to the shop and not able to do anything, but at least wasting time going out there for something to do.
You had said it would take a few days to recover where it wasn't normal. What were you doing during those 2 days? What were you feeling?
Just, I mean, I don't know, sitting at home doing nothing, laying in bed, and basically just being tired more than anything.
Tired. Okay, tired. Jeremy Yenser has a question. He writes, I have a friend with severe epilepsy that bizarrely can trigger her seizures at will. So his friend can trigger her seizures at will. And he goes on to say, it's crazy to me, but certainly was helpful to the doctors when they had her hooked up. When you can see a seizure fire off in real time, what is so helpful about seeing it?
Oh, that's a good question. So we do see that sometimes with the reflexive epilepsies where certain things can trigger it, even like music can trigger seizures. So it's a really interesting process. On the EEG, we're looking at where they're coming from because that might change what type of treatment options are available to the person.
Okay. Marie wants to know if we can learn more about the surgery itself. So she wants to know, do you keep the patient awake during this surgery like with some other brain surgeries?
Sometimes it depends on the situation. Most of the time they're asleep and the surgeon makes an incision, removes the skull, and then takes out the part of the brain that's causing the seizures. If it's near areas that can lead to like weakness or sensory changes or speech changes, if that area is removed, sometimes we will keep the person awake so that we can test them during the procedure.
We've seen the videos of the guy playing the violin during his brain surgery so they can see if he can still play. For Brad, was he asleep or awake during the surgery?
He was asleep.
Asleep, sound asleep. How long was the surgery?
I honestly don't know how long the surgeries usually are. Do you, Allie?
They're usually booked for about 4 hours.
4 hours.
Mm-hmm.
I want to wrap up our discussion with today's takeaways. Brad, what do you want viewers watching to know about epilepsy?
Don't wait all your life to get it checked out. I think things could have been done sooner, but other than that, just figure out what works for you.
And Kay, what's your message? Oh, go on.
No, I'm fine.
Kay, what's your message to people who might have a family member or a loved one with epilepsy?
You have to have a lot of patience. Make sure you're patient. You got to give them a lot of grace. It's scary, but it is common, more common than you realize. Just basically let them know that you're there for them.
Mm-hmm. Allie, you meet people every day and you're counseling people as you make their appointments and talk to them. What do you want viewers watching to know who haven't made an appointment yet?
Yeah, I would say to advocate for yourself or your loved one with epilepsy, to go ahead and get that second, third opinion, get a quality second opinion at a level 4 center like we are here, and just never give up.
Your level 4 center, what does it mean to be a level 4 center?
It means that we do neurosurgery here, and we're able to do the epilepsy surgery process.
Which explains one of the reasons why someone like Brad is referred here from as far away, at 5.5 hour drive away. Dr. Logan, what's your final message to our viewers who are watching and learning about epilepsy?
I would say epilepsy doesn't define a person, so keep that in mind if you know someone with epilepsy. And then also seizures look different on different people. I hear that a lot from patients, that they're like, these can't be seizures because that's not what I see on TV. And it's not always the big convulsions that are seizures.
Thank you for taking the time to join us, to both of you, Allie and Dr. Logan. And Brad and Kay, we're so glad you're both doing well and that you have the seizures under control. Thanks for joining us.